तुम अपना ये माइक बंद करो।
Good afternoon, friends. Today's webinar is Demystifying.
Is it camera?
Welcome our working director, Dr. L.K. Awasthi, who is the director of NIT Jalandhar and our chief guest, he is busy with his some schedule. Dr. Harmeet Singh Bahuja, who is the IAS, Dr. Vinay Singhal, who is the additional director and HOD and Department of Medical Care Unit, Fortis Hospital, Dr. S.K. Mishra, who is the registrar, Dr. S.K. Pahuja, who is the coordinator of our medical, and Dr. Snagi. I request Dr. S.K. Pahuja. I think he may be facing some difficulty or technical issues. So I request our patron and director, Dr. please say a few words about COVID-19. Welcome, sir. Welcome.
Good afternoon and greetings from NIT Jalandhar. I would like to congratulate the medical officer, Dr. Tarun, for taking this initiative of having a webinar on demystifying COVID vaccine. And I would like to welcome Dr. Vinay Singhal, Additional Director and HOD, Department of Critical Care Medicine, and Dr. Harmeet Singh Pauza. He is not able to join right now, but he'll be joining in this short time. NIT Jalandhar, as you know, this is one of the institutions which has very good recent past history. We have been 52nd in the NRF ranking, and we have also made a very good debut entry to A grade in Atal ranking. So institution and faculty is engaged in the research pursuits in technical education. The medical facility provided to the students is quite good. Now we have 2 doctors on campus. There is another doctor who has been engaged, and there is a psychologist also we are in process of engaging. And this is a good time that we should talk upon demystifying the COVID vaccine, and everyone connected, I think, will be benefited by this talk. I put on record my appreciation to Dr. Pauza as well, who is looking after the medical facilities. And I think we should now listen to the doctor regarding this topic. Thank you. Jai Hind, Jai Bharat.
Thank you, Dr. Awasthi. And I think, am I visible and audible?
Pahuja?
I'm not
okay.
able to.
So today's topic, let me introduce our expert for today's topic, who is telling us about demystifying COVID vaccine. So our expert, Dr.
वो फिर नहीं अवेलेबल नो फाइल कैसे स्टार्ट करोगे इसे सर बंद करके दोबारा यार
I request Dr. S.K. Mishra, sir.
Hello.
Hello.
Yes, sir. Yes.
So you are not audible.
Good evening, everyone. Am I audible? So everyone actually
It's visible.
Yes. Dr. Vinay, and first of all, I would like to thank Dr. Awasthi especially, and all the teams of NIT for giving me this opportunity to interact with you all. I would like to share few of the things, and we can discuss about the problems or any issues related to the vaccination of COVID with each other. I think that's the part of the problem today, and we all are facing. If you can, all of you can see my presentation and listen to me. Am I audible, everyone?
Yes, sir. Yes, you are audible.
Right. Thank you, sir. Sorry, it's all actually there are so many glitches, and even if this in these times, though it is not as acceptable as it should be, but again, yes, we have some of our own share of problems and problems with the connectivity. So I would like to have a small presentation kind of thing, and I will go through this presentation. We'll discuss. If anybody is having any queries during the presentation, he can ask me, or we can have discussions at the end of presentation. I think it's a very short presentation. So we all are worried that yes, for last more than a year now, that yes, we are going to face this COVID. Then we had actually COVID in our your day-to-day practice. We had seen that lockdown, we had seen, and then everybody of us was waiting for vaccine. Yes, vaccine आएगा आएगा आएगा, and कैसे काम करेगा, how this vaccine is going to work. So we all now I can say that I had gone through this. I had taken my 2 doses of vaccine. Yes, day 4 yesterday I got my second shot of vaccine, and I can say whatever as for my experience with both these doses, and we had around 500-600 people got vaccinated in the Fortis Hospital Ludhiana, and others also in the in Ludhiana city and other cities of Punjab and India and all over the world. People are taking these vaccines. First of all, my bottom line is that they are safe as far as vaccine is concerned, because we are having 2 issues. If this vaccine is going to work, number one, that is a smaller issue. The bigger issue is that is it going to be safe for everyone. So we should not lose a person by taking a vaccine. We should not have a complications by taking the vaccine. So as far as in last 1 to 2 months since this vaccination has started, I can say that we haven't received any major or less than major complications. Whatever complications which we had seen till now, they are very, very mild. So with that, I would like to start my presentation. That yes, what are the issues we may have with this COVID. So what we had seen a novel coronavirus infection, and with a tremendous human-to-human transmission. So why it is novel? Because we haven't seen this kind of this virus infection, this viral infection. No human beings were exposed to this viral infection till this time. So we call it novel. No previous exposure to it. No known effective preventive or therapeutic drugs, and pandemic was spreading widely. So when it was in China in the months of December and January, when we are seeing the videos on the social media they are coming from China or in TV news, everybody in the world was thinking no, only China will get affected, we will be saved. Some people are saying that yes, we are going to this virus will not survive in the summers of this thing, Indian summers, and or temperature and whatnot, and it will be restricted to the China. But once it started spreading out of China, and then we had seen cases in the Europe, especially it started from the Italy, and then everybody in the world got affected. So in true meaning, it was a pandemic. So diagnosis was there was no diagnostic facilities even for this COVID infection, and then we had RT-PCR, and very few labs were doing RT-PCR for COVID to start with, but then more and more labs has started doing, and rapid antigen test has come, and we had seen some surge in the diagnostics. So this pandemic is that pandemic, we call it pandemic. That why it is called pandemic? Because it is involving major population or major countries of the world, and to explain that we have some diseases which are sporadic. Sporadic diseases are these diseases are prevalent in certain areas, or sometimes it occurs, sometimes they don't occur. So few peoples will be affected and then will they die out, and it will keep on recurring at certain interval, but they not much of population will be affected. Endemic we call because major part of the our society or major part of a particular region, zone, or cities are affected, then we call them endemic. And then major states, countries are involved, then we call it as a pandemic. So this is important to know why we call it a pandemic. And for last 1 year, healthcare and all other frontline workers who are working hard to protect our susceptible population and waiting for the vaccine. Everybody was waiting for the vaccine, but what happened? The vaccine has come, and then now we are worried how should we get this vaccine or not. But again, why it is needed? Vaccine is needed because we are still not following the norms of social distancing, hand washing, and preventive measures. We don't know how to wear a mask even in public places. We had seen the mask is either hanging in the neck, or it is hanging on the covering the chin, covering the mouth, or some whatnot. So we and it's not our poor countries like India and in subcontinent. It's more in the countries like Europe and America. You had seen more and more number of cases in those countries and more mortality, very high mortalities in the Western countries. So so-called sophisticated developed countries, they suffered the most. And because of whatever is the reason, we people in the Indian subcontinent, we are actually relatively safe. If we think of COVID, we are relatively saved during this pandemic, because the kind of mortality your European countries and Americans had, we could have been, we are in very well position as far as this pandemic is concerned. So, as it is a novel infection, novel virus, so there are some novel ways, because we have to bring this vaccine to the market as early as possible. So we need a vaccine to protect our population, susceptible population, because we are not changing our ways of living, our ways of approaching, our approach. We still want to. Why can't we do a party? Why can't we do why can't we socialize? Or what others will think if we don't go to their place at the time of death, or any or for that matter any function, also any happiness, or anything like when they are in. So we are not socializing, and we have to accept this. Yes, that we haven't socialized in last 1 year, but again, people are not. There are certain people who still are doing it. They never stop themselves and keep on meeting the other people. So we skipped the animal testing, and we had used certain part of the research that was done for the Ebola virus vaccine that was going on earlier on, but because Ebola was eloped from the this thing, and so what had happened? People have used that research for COVID-19 vaccine. So we skipped the animal trials, and they had allowed the vaccine very early, because you see the first vaccine which has come to the market, it took decades for us to make that first vaccine. And then then last few years I think we had made this vaccine. We delivered it to the market within 8 to 9 months, I think, if because most of the countries started the research in somewhere in Jan and November. I think it was it was out. October, November, it was out in the market. So we had skipped certain things, certain parameters. So how do this COVID-19 vaccine works? We all have this kind of question. This question in our mind. So how does this COVID-19 works? COVID-19 vaccine works. So what they do is that we take the virus, we take there are some capsule of the virus and nucleic acid of the virus. So what they had done, they had taken out the in some there are 2-3 kind of vaccines. One is we always looking at Pfizer and Moderna vaccine, that is an mRNA vaccine, and then virus vector vaccine like Covishield and Sputnik, and then certain other vaccines are killed virus vaccines like Covaxin and your Sinopharma from China. So few of these vaccines are different type of vaccines. Examples are there. So how all these vaccines have some component, either actual component or they recombinant, they make it in the lab and against certain spike against certain nucleic acids, and they make copies of that nucleic acid or some sites of the nucleic acid, and they are injected into the human body. And once it is injected into the human body, mostly intramuscular, they're injecting, it goes into the cell, and once it is in the cell, it generates the antibodies. Body reacts to that foreign body and develops the antibodies. So whatever mRNA vaccine also works on the same principle. All the vaccines, they work on the same principles. Why there is a difference? Because component of these vaccines are different. In Pfizer and Moderna vaccines, which we call it as mRNA vaccines, which require very low temperature for maintenance and all. So they have mRNA, exposed mRNA, and it is they are dissolved in certain lipids and other carbohydrates and something like that, and then the whole thing is injected into the human body, and it doesn't contain any other thing. They're the pure mRNA vaccines, and they contain only COVID-19 nucleic acid probes. Then some vaccines are virus vector vaccines. The same mRNA is we use a virus like bacteriophage viruses or other viruses. They take the shell or capsule of those viruses. The mRNA is injected into these. That RNA is injected into these shells, or they are covered by mRNA is covered by these shells. So they are relatively stable vaccines. So they don't need that low temperature to increase the shelf life, and they don't need that low temperature also. They can be kept between 2 to 8 or 6 to 8 degrees centigrade. And these vaccines, because they are covered, RNA is covered with the capsule of the virus. So they are injected into the body, and again the function will be the same. Then Covaxin and all, they are killed the viruses. So whole virus component is there in these killed vaccine, and again the antibodies developed to the many other components. So mRNA vaccines or virus vector vaccine, we don't have antibodies against each and every part of the virus. We have only certain sites, recombinant sites of nucleic acids. Some certain sites are there, those are picked up, and they induce an antibody reaction in the body. So why there are 2 doses for vaccine of these vaccines are needed. When the vaccines are first tested, a relatively weak immune reaction was found within a few weeks after people received the first dose of vaccine, followed by the strong reaction when a second dose was given. So they were given first dose and it induced a smaller response, and then once people are given the second dose, because body is already prepared partly, so it shows a stronger reaction to the second dose of the vaccine and foreign body, and then it is not known how well the vaccine works. Even if one dose is given, it is not clear at all. Still, Johnson & Johnson, I think they are coming up with a vaccine, and they say that it works. You need only one dose of that vaccine. I don't know how much time it will take for that vaccine to come. So when should the second dose be given? Usually they say that you should give between 3 to 4 weeks, and we are using other vaccines also in pediatric populations. We must be knowing that they are given whenever there are to DPT. We give 4 to 6 weeks every month for 3 doses and all. So there is a gap of 3 to 4 weeks, 3 to 5 weeks, 3 to 6 weeks should be there between the two doses, but it should better be it should not be more than 6 weeks. In India, we are keeping a gap of 28 days, 4 weeks, and not only India, it's most of the countries in the world. They are keeping a gap of 28 days or 4 weeks between the two doses of vaccine. The questions can also come that do the new SARS-CoV-2 variant affect the vaccine efficacy? So there are reports of UK variant, new UK variants, or South African variant. So UK variant, they had tested all these present vaccines. They are effective against those variants also. And South African variant, we still have to wait for the confirmed reports, but they say that yes, our against South African vaccine variant, few of the vaccines are not working, and the final your this thing has to come very soon because tests are going on. They are looking for this variants, and they are testing it in labs. So final version has to come. That yes, but as of now, South Africa is saying yes, few of the Covishield vaccine are not working against the South African variants. So we have a very robust number of vaccination till now. You can see that around this is February 9th Feb data. So you can see that 65 lakhs as of yesterday, around 1 crore of Indian population has received, 97 lakh something has received that second dose of their vaccine as of yesterday, I think. So around 97 lakh population is vaccinated overall, and but exact number I don't remember exact number. So we have a very good program, and we are using. India is having a very good your vaccination program for your pediatric population. So we had used that network, and we are seeing that we had used that network, and we are vaccinating our population very fast. So everybody in the world is having given us a very good thumbs up for our vaccination program, and not only to our own vaccination program. We are helping the world in fighting the COVID. We had sent this vaccine all over the world. We are keeping we are already making, when before this COVID also, India was making around 60% of the world vaccine. 60% of world vaccine is produced in India only. So we are helping in COVID also. We are supplying these vaccines to all over the world, and we are performing far better than the many European countries. Again, I tell you, because there is a war like thing is going on in Europe, that yes, we will not give it to your country, will not give it to your country. We will keep it for our own population. But India had shown the way by sharing their vaccine doses all over the world. And then comes who should get the vaccine first. So I think people we are still asking the people not to come out of their houses until unless they have a definite work. So if you are don't roam around in the market, don't roam around in the public places. We say avoid going to the social gatherings. But few people which cannot stop from going out are the doctors, which have to, and they have to see the sick patients. Like we are seeing for last 1 year, we are seeing we had treated in our ICU, we had treated around 800 to 1,000 patients till now. So people who are working with the patients with COVID or any healthcare person who are dealing with a sick patient, they are getting the vaccine first, and then comes the our elderly population or population which is not only healthcare workers, it's frontline workers. I should say frontline workers, the people like police, the people who are our safai karmcharis, or and people who are involved, who cannot sit at home and who have to deal with the public. They should get the vaccine first, and then comes the your definitely elderly population, which can be affected, which can be affected because of some. This is what has started in India. The first case in Delhi, we had seen that young boy has come from Italy, and he had mild illness, and then he has had infected his parents, and he lost his father. That was the first case in India, first few among first few cases and first mortality in India, in fact. So elderly populations, susceptible populations who are sick, having some immunosuppressive illnesses, diabetic, CKD, and all these things, they should be people in the second line who should get the vaccine now. So uh, there was a survey that why people are opposing this vaccine, why people are saying that yes, why I don't want to take this uh, vaccine. So most common reason is that I think the vaccine may not be safe enough. So yes, we also have this thing in our mind that this may not be safe enough, uh, but we had seen this safety now for more than few months all over the world. Most of these vaccines, we haven't seen any more than mild illnesses, mild body ache, fever. These kind of things are happening, but again, there is no serious complications of these vaccines. Yes, I'm concerned about the possible side effect. Yes, almost similar, slightly different. I do not believe that COVID-19 is dangerous for my health. But again, it may not be dangerous for your health, but it may be dangerous for your community, sicker patients in the community or elderly in the community. You may be a carrier. It may not be dangerous for you, but you may be a carrier and you can affect your parents, your elderly at the home, and they can be affected, and they can. Actually, we had seen the mortality in that group only. I reject vaccinations on the principle. I don't want to talk on these people and what kind of principles they have. It is best to let the nature take its course. Yes, if nature takes its own course, it will we are going to see a very high mortality in this case. And again, it has seen that some countries like Belgium, they had said that we are not going to do lockdown, and that will stop our spread of COVID after we'll get the herd immunity. But herd immunity usually occurs once 60% of the population is gets affected by a particular disease. But again, it is not. It had not occurred in case of COVID, because there are cities or states where more than 80% of the patients are affected, or they have that kind of antibodies. 80% of the patients are having the antibodies. Still, they are seeing the spread of disease. So, and for that, if we look at the mortality of 2%, and if you want to have that kind of herd immunity in India with a 140 crores of population, and what you can make out the percentage of that 140 crores, 60% of that 140 crore, and then you can calculate the mortality on that basis. 2% mortality, 2 to 3% mortality in the population of 140 crores, with 100 crores are getting infected. So you can see the number of mortality due to COVID if you want to get that kind of herd immunity. So best way to generate this herd immunity is that yes, you have to take the vaccine. And who shouldn't take the vaccine shot? As of now, who shouldn't take the vaccine shots. So if we have allergy to the vaccine components, if we are having fever at the time of vaccination, bleeding disorders, received another COVID-19 vaccine, if we had received Covaxin or Covishield, then we should take the second dose also as the same of the same vaccine, same make. And a severe allergic reaction to any ingredient of the vaccine, and mentioned medical conditions and supervisors. So if you had mentioned, if you go to the vaccine center and you say that yes, I have these kind of problems, then the person who is supervisor at that vaccination center, he may say yes, you cannot take the vaccine. If you are under 18 only, I think Pfizer one, I think you can take up to 16 years of age. Other all vaccines are, as of now, they are said that you should not, if you should not take if you are less than 18 years old. It doesn't mean they have some contraindications, because less they haven't finalized the doses for this pediatric population or population less than 18 years of old age. And in patients who are immunocompromised, again, we don't know how they are going to have this how they are going to make this vaccine, how they are actually produced, how they will produce to the how they will react to this and how they will produce the antibodies to these spike proteins and all, nucleic acids and all. On the medicines that affect your immune system, again, patients who are on high dose steroids and that affects your immune system, then you should avoid this vaccine. Pregnancy and breastfeeding, trials are going on. It is not a contraindication. As of now, it is a contraindication, but again, the trials are going on for pregnant and breastfeeding females for your vaccination for this COVID vaccine, and they will be coming out with their data and safety data. Especially, we are worried about the safety data in this population also. So once you have vaccine, then you may get some amount of side effects. Few side effects are immediate side effect. Few side effects may be delayed over few days. So, but again, it is herd immunity. You have to accept that herd immunity is important to stop the pandemic. You cannot say that yes, I'm having my neighbor is taking, my family is taking, I may not take. But again, if everybody will talk in this manner, then will not achieve this herd immunity. So herd immunity is important, and herd immunity will come only two ways. Either our population, 80% of the population gets affected with COVID. This is one way, then we'll have very high mortality. And then other way is 80% of the population is getting vaccinated. So if we vaccinate our population, a good number of percentage of population, then we can say yes, we are safe and we can stop this pandemic. And even after your pandemic, once you have taken the vaccine, you should not stop the COVID appropriate behaviors even after this vaccinations. You have to wear the mask correctly, wash your hands with soap and water frequently and thoroughly, and use hand sanitizer, maintain physical distancing. If you see any symptoms, you have to go for prompt isolation and visit your doctor. And if you see and you get yourself tested if you are having any symptoms before vaccination or after vaccination. Few symptoms may be there. Even after the vaccination, you may have some symptoms, flu-like symptoms, but they will be self-limiting. With this, I'm closing my presentation, and I'll be happy to answer your questions. Thank you very much.
तरुण सर, आपका माइक म्यूट है, अनम्यूट करिए.
Yes, Dr. Tarun, Bhupender ji.
Yes, sir.
आवाज आ रही है. Yes, I think there is a problem with Dr. Tarun network. So I think dear participant, if any question are there, please put your questions. Yes, I don't think there is any question. So I just have one query, Dr. Vinayji. So basically, there is a two different vaccine in India right now. So generally, there as a layman, there is a question that which vaccine is better? Should I go with the COVID or some others? So what is your view in this regard?
Thank you, Dr. Mishra. Thank you, Dr. Mishra. And actually, first of all, we don't have any choice of vaccine as such. That yes, if the government is giving us this vaccine as free, then we have to accept whatever government is giving. So in Punjab till now they had supplied Covishield. In Delhi government sector they had supplied Covaxin, and in private sector they had given Covishield. So nobody had any options. We had our bosses, and you might also be your known people. People might be there known to you in Delhi. That husband is working in private sector. He's getting Covishield. Wife is working in government sector. She had received Covaxin. So if you go as of which vaccine is better or which vaccine is not, it's very difficult to say as of now, because we are not at all looking at the efficacy of the vaccine right now. We are more concerned about the safety of this vaccine, because as a healthcare workers we are being exposed. For last 1 year we were exposed to the all these patients, COVID patients, for last 1 year continuously, and then again for last few months, 2-3 months, or whatever is the time, all over the world, healthcare workers and frontline workers had come forward and they are getting the vaccine, which you don't know how much safe exactly, and how much is the efficacy. But yes, safety issues, as far as safety is concerned, people have done this trial and they are saying that yes, this vaccine is safe enough to be taken by our population. Uh, Better vaccine, I'll still say, I'll go for Covaxin. It will be a better vaccine. If you see a long-term efficacy of this vaccine, because Covaxin is a killed virus vaccine and it contains the whole virus. So I can presume that yes, this Covaxin should be a better vaccine as a whole.
Okay, thank you. Another question come to me. Hello. Yes, basically there is a after this vaccination. So as always, as you are also talking in your lecture, that after the vaccination also we require to protect ourselves through use of mask as well as regular sanitizers, hand sanitizer, etc. So what is the why? Well, after this vaccination also still we are have to safeguard ourselves through the mask. So what is the difference? Why we do require? Let us know this mask and other protection.
Am I audible? Yeah.
Yes.
So what we had seen that even after taking the vaccine, no vaccine is 100% safe. The efficacy of all these vaccines are in the range of 60 to 90%, as shared by different data, different articles all over the world. Pfizer is claiming it's around 95%. No vaccine in the world is 95% effective. For all these years, 100, we are having around history of around 78 years of this vaccination. No vaccine is have an efficacy of 95-100%. So on one end, we don't have full safety, full efficacious data. Other hand, that even after taking vaccination, we can be carrier as such. So if like we are exposed to somebody, it will not affect us, but we can carry this virus, and we can carry this virus to our home or to other people. We can spread. We can be spreader, silent spreader. but will not be affected. So this is very important to maintain the distancing, social distancing. We have to take the precautions so that we should not be injurious to others. This is the behind this having the social distancing, because we can always be carrier even after taking the vaccination as such.
Great, great, sir. So I don't think there is any other questions from the participants. So we are moving to closing this session. So thank you, Raksha, for having a wonderful session on this any kind of doubts or query from the related to COVID vaccine. So thank you, Dr. Vinay Singalji. So you have made a very good lecture on this vaccines and all the doubts you have cleared. And thank you very much. I hope in future also, if we require any kind of help from you, definitely you are available. And thank you, Dr. Swineji. And I am also thankful to Dr. Harmeet Singh Pahuja. Basically due to his busy schedule, he could not able to join this session. So thanks to him also. Thanks to Professor L.K. Awasthi, our director of the institute, for sparing his time and during this our inaugural session, he was here with us. Thank you, Professor Awasthi. Thank you, Dr. Pahuja, convener of this program, coordinator of this program, Dr. Tarun Sengal, and Dr. Sitachi for organizing this wonderful session. I hope and thanks to all the participants who are with us for this whole session. Thank you, everyone. Thank you very much.
Thank you very much, sir. Thank you very much. Thank you.
Thank you.